deep curiosity and humility and connecting the dots of all these people and figuring these things out. It's really exciting. So glad to see you out there doing the work.
Appreciate it. Yeah. I mean, there's so much that we can learn from everybody, right? It just kind of comes down to the questions that we're asking and sort of what we're hoping to uncover, what their role might be. And so when you look at those different aspects and then you kind of orient your questions based on that, there's almost no telling what you can learn.
Yeah, exactly. Well, with that, I'll do the intro and welcome everyone to Payercast, the Price Transparency Podcast. And we are very humbled, excited, honored to have our good friend, Andrew Gordon, joining us on the podcast today. And I'm just going to do a quick intro for those of you who don't know Andrew. I'm sure a lot of you do. Andrew's a licensed social worker in the state of New Jersey. He started his career in healthcare, focused on mental health. And since then, he's been researching price transparency and health economics to better understand the healthcare system as a whole, a significant endeavor. And he secured funding from the National Science Foundation that's fueled a lot of his work and his travel. We met him on his travel and we're really blessed to have met him and created this connection. He's been on this journey for 2 years now. We first actually met at the National Price Transparency Conference, which we were really kind of lucky to stumble upon, us being in the price transparency space and seeing there's a National Price Transparency Conference. I remember Jerry reached out and was like, hey, I think we should be at this since this is what we do. And that was in Indianapolis. And we met a lot of great people. Shout out Gloria Sachdev for putting that on. We met all kinds of great people in the price transparency space. We learned a lot about and heard a lot about how employers were thinking about price transparency and their fiduciary responsibility to their employees and being able to kind of either be aware of and collect all of that waste that happens in administrative overhead and fees and TPA, the TPA and insurance layers. And we're really blessed on that day to have met Andrew. Andrew and I were actually going back and trying to remember how the heck did we meet? And we felt like we feel like we've known him forever. I definitely feel like I've known him for a long time. So with that, I just want to give a heartfelt welcome to you, Andrew. Thanks for joining us today.
Thanks so much for having me, guys. Yeah, super relevant about where we first met, right? There's an actual conference on price transparency, a relatively newer one that was put on by the Employers Forum of Indiana. So that was a first time in Indianapolis for me, first time in the state as well, and just had a blast learning from some of the leaders in the space and, you know, even having that recording from Mark Cuban that played where he even did a blurb for the audience.
That's right. That was very good. I remember that. There was so many great conversations. There was Chris Deacon and Senator Braun was there. Yeah, that was really, really good. A lot of great connections. I mean, you know, we've seen you there. You know, I see you in your kind of social media on LinkedIn, shaking hands, visiting people, sitting down with people. We saw you at HFMA. Like, what's been your perspective on this whirlwind tour that you've been doing in 2024? Just visiting all these healthcare conferences, learning about price transparency and health economics. Like, what's your take after the run this year?
Yeah, so great question. What really, really excites me about the space and also just the different conferences, the different folks that I'm talking to is there really is something that could be learned from everybody. And the reason why I say that is because even if you meet somebody and they're saying to you, hey, I don't work directly in the revenue cycle, or hey, you know, I don't really handle the coding and I'm not necessarily sort of the CFO, or nor do I report to, so it's really hard for me to understand these things. That actually doesn't necessarily apply because we're all patients at the end of the day. So irrespective of where people sit, sometimes when I'm approaching them and they're saying, hey, you know, that's interesting, I don't know too much about that. And then I'm just like, well, hey, you could also just sort of chat about it with your patient hat on instead of necessarily the role that you represent in healthcare. And so it's been really, really helpful because when you approach people from a different perspective, it unlocks an opportunity where you can learn more from them. And then usually that will lead to them recalling a healthcare experience they may have had, which once again, if you're good with the questions where you can pick into that, you can start to uncover and learn a little bit more about what they experience, and that this problem, right, this lack of transparency continues to remain a very pressing and pervasive one in our industry.
Got it. How did you get into uh, research? Like, what inspired you to pursue research in healthcare price transparency? Um, yeah, well, I mean, what does being a researcher mean to you?
Sure. Yeah. So the research started out of personal curiosity. I think when we look at research at its core, right, the goal, at least for me, is to be able to just understand something that I had really no sense of how it worked. Right. I mean, when we talk about healthcare finance, I think it'd be an understatement to say that it's complicated. It's very
Yeah.
challenging. And so for me, I kind of was looking at one of my bills that I had received for this MRI. I had went to a facility to get an MRI, and it was a very high out of pocket, something like $700 after the bill came through and was processed by insurance. And I was just perplexed at the numbers that were represented, right? Bill charges versus the allowed amount or the negotiated rate. And when I was looking at this, I couldn't pretend to understand half of it. And so I thought to myself, as a social worker, as somebody who wants to advocate for those who may be at a societal disadvantage or who may have historically been marginalized, or just really any patient that's going through an incredibly tough time, how can I put myself in a position to be able to serve them and be able to help explain things? And so I just started asking a bunch of questions, would call up the insurance company that I had at the time and ask them about the bill, how it worked. I gave a call back to the radiology facility. I did the same thing there, getting on the phone with the scheduler and the coders or billers in the back office. I actually physically showed up in person to ask them some questions, right? Just keeping that energy high. And it was amazing, right? The goal really there was knowing that if I really tried to talk about healthcare finance or price transparency or any of those things in the very early days, people would probably quickly be able to tell, like, hey, this guy doesn't really know what he's talking about, or he's super early in his journey. And so the research really stems from this deep desire to understand and to learn.
That's awesome. What was that like, going and visiting in person the billing team? Like, what what put that in your mind to do? How were you received? How'd you get inside the
Yeah.
facility?
So I would say relatively well received considering the circumstances. I mean, I was just recently a patient at that facility. It was after the scan as well. So, but it was well received. I think the reason why I did that was because over the phone you can only get so far, right? And there's only so many different people you can speak with. But when you're present and you show up and you're really asking to understand and you're showing that commitment to learn more, it can open up opportunities, right? So there was somebody that, a manager that came out from the back office and said, hey, let me print something out and let me help you. So they were incredibly helpful. I was able to talk to the person in the business office who registered me and checked me in. And little did we know, later down the road, it ended up there was actually a glitch in the system that didn't allow my insurance to register properly, which sort of led to them not producing an accurate out of pocket estimate. And so we kind of had a little bit of issues that we had to work through on that front. But once again, it just goes to showing that unless you're there and you're putting that time and energy in, it's really hard to get to the bottom of things. And I think that's also very reminiscent of what we're seeing in transparency, of how complex it is and how important it is to really understand the nitty gritty details, but also registering the fact that it takes a great sum of time to do that. And time these days, as we know, is incredibly valuable.
I think that's good to remember, is while the system emotionally receiving that bill, you feel like the system is evil. You feel like the hospital system is evil. Insurance is evil. You feel like nefarious. Um, there are nefarious kind of entities or actions kind of out to get you and squeeze you. But then a lot of this is just a very convoluted, complex system with misaligned players. You show up in person and you have people kind of receiving you, helping you figure out the problem. That's just an interesting contrast to how we think about it, right? When you just get a piece of paper and you feel that pit in your stomach as you look at the bill that you can't afford versus going there and being like, oh yeah, absolutely, let's go. Oh no, there's a problem with the system. So that's maybe more of the human side of what's really going on here.
We got to keep that in mind for a use case. How can we just trace exactly what you did physically, and can we build that with technology? At the very least, like automated sort of, you don't have to physically go to this place, but you could go and look to see if like, all right, well, here was what your plan was, and here's what you should have paid, or at least at that facility, right? The hospital data is out there. So you could say like, well, this is the discounted cash price, but I shouldn't have gotten a discounted cash price. I should have gotten something that came from my insurer that said, hey, we sent this claim in. They came back and said, you didn't meet your deductible yet, but here's what we would have paid. Here's what we're going to apply to your deductible. And how can we like at least make it so that you can maybe just quickly upload that bill and then see like, oh, some mistake happened, right? Then you at least have a starting point. You can call them and say, maybe we can downstream automate some of that calling and adjudication as well. But that's a great use case, I think. And you're absolutely right. Like our experience has been almost everybody like is willing to help and wants to do the right thing. If you're in healthcare, you're trying to do the right thing.
Yeah.
But the scale of the problem is so large, and it's always like immediate. Everything in healthcare is like, this has to happen now because it's life or death. It's different than other industries where it's like, hey, we're going to take 6 months. We're going to implement a nice ERP system here. It's just, you just can't operate that way. You're implementing Epic. That's why you're spending $100 billion on it. They're paying to implement Epic while they're also seeing patients, and they have 2 EMRs up at the same time. And, it's a very kind of life or death industry. So I think there's the technology and the systems tend to really lag behind. Yeah. And so this type of stuff happens, and it happens very frequently. Yeah. And to your point, if you're not there to catch it and spend the time, you're just going to be kind of stuck with a bill that you don't actually owe.
That's right. Yeah, I think that's a great point too, Jerry, because there is this technology lag. And I do want to focus on that because I think sometimes, right, we could jump to the conclusion of thinking that there's malicious intent or there's bad actors or other things, when in reality too, and this has been through a lot of the research, is just understanding the complexities that underpin being able to deliver an accurate or an adequate estimate to somebody or some level of transparency. It takes a lot of different pieces of information that arguably are somewhat siloed in different regards, or can be with different corporations or entities that make up this supply chain. And so threading all of that together does take a lot of energy, and it also does take a lot of alignment on the technology side. And so with that lag there, it becomes difficult. So I've really been able to expand my mindset, right? And I think that a lot of the public might say, hey, these people they're intentionally withholding this, they're intentionally bad, when maybe when you're popping under the hood and you're seeing some of these things, right, and you're looking through different lenses, you can appreciate and understand their position a little bit better, right? And then also being incredibly adversarial with anybody doesn't necessarily lead to the improvement or the change that you want. I think that's an important point that should be made as well.
I think that's a really good point. There's a lot of healthcare thought leadership out in social media, and there can be a lot of negativity, snark, and dunking on organizations. And while it's fun and gets a lot of likes and comments, I think, to your point, probably not going to get everybody very far by kind of public shame and assuming malicious intent. No, maybe there's some of that, but to your point, I don't think it's very helpful. And there are more, we need to be hopeful and positive that there are more people trying to do good that we can partner with and work with to build this coalition. Go ahead.
Yeah, I was also just going to say that in addition to that, I do think that we should acknowledge the emotion, the frustration, the other challenges that they're experiencing. It's not that those aren't justified. It's just that in order to create the change that we want to see in the world, we have to go about delivering that in a very intentional and specific way. And so I just think that as I go about my journey too, that's something that I'm being very mindful of. And I want to be able to deliver as much value as possible. And a lot of that I've been able to understand and see through the research with being able to connect to these different groups, right? And these different entities and organizations and people at all different levels in the ecosystem, from C-suite down to the folks that are directly picking up the phone and scheduling patients, right? It takes a different mindset or narrative and ability to engage in dialogue with those groups in a very, very thoughtful way.
That makes sense. Let's get into that. What is your goal with this research? And maybe either before or after that, or within that answer, what is your definition of healthcare price transparency? It's got so many perspectives. What does it mean to you, and what are you trying to accomplish with this research?
It's a great question to put things in perspective on the transparency front. So when I think about price transparency, and there's a lot of ways, and I also will introduce myself or tell people that I'm doing research on price transparency. And that's also a question they have for me. They're like, how do you want to slice and dice this up? Because we could do price transparency throughout the entire supply chain and have, a days long discussion. So I think when that term comes to mind, what I remind people is, to me, it represents the out of pocket price that is to be paid by a patient following adjudication or some sort of processing of whatever their coverage scenario looks like. So if I'm going and, for example, it's just a copay, I have a $20 copay for that visit. To me, it's saying, Andrew, when you go into this facility, you're going to be required to pay $20. Jerry, when you go to get this scan done, based on everything that's in our system with the allowed amount and what's your deductible progress, it's going to be $250. And so to me, that's really what transparency at its core is.
That's okay. So very much a patient-centric perspective, which makes sense because that was the beginning of your journey. And I think that's right. I think that's there's transparency that we need throughout the system, but that's for efficiency, reducing waste, fraud, lowering the costs, those kinds of things. But at the end of the day, the patient needs to understand what they're paying for and why, and hopefully understand that before and when the situation allows, before they get into a situation, especially a life-altering situation from a financial standpoint.
Yeah, it's tough too, right? Because there's a percentage of healthcare that is elective and predictable. There's another percentage of our industry that remains emergent or emergency care, and things like folks just walking right into the ER, where in a logical scenario, they will have no time to go through and do that. They need life-saving care. They need to be seen that same day. And so these discussions may not seem as relevant, where it's like, hey, I want to figure out what my copay is or what I'm going to be responsible for. I just need to be seen. And so our industry does a great job of being able to provide for that in those very, emergency seeking scenarios. But I also do want to take a moment to point out that while I did explain that that's what price transparency initially means to me, it doesn't mean that as I've gone about my research, I haven't been looking at transparency through the other lenses in understanding how do we see variability on, for example, the allowed amounts or the negotiated rates, sort of sometimes used interchangeably, right? On what are the insurance companies and the health systems, and how much does an allowed amount or a negotiated rate vary, and what are some of those factors that influence that, right? So would love to throw that question back to you guys on what you guys have seen in terms of some factors, whether it be site of service or where a service gets done as influencing that amount. And then also just understanding the discrepancy or the amount of variation in those rates.
Yeah, from my perspective, and then I'll let Jerry go, it's just really been the asymmetrical nature of understanding the price of things, especially for the smaller healthcare organizations. A lot of times the larger healthcare organizations that have all of the physicians wearing their jerseys control a market, not only the hospital kind of inpatient side, but the outpatient side, the clinics and urgent cares and imaging centers. They understand their economics a lot better. They have a different kind of relationship with insurance companies. It's much more of a give and take. There's power on both sides there. But what really gets me kind of passionate about this is the physician owned organization, the primary care office, the imaging center that doesn't understand the huge variation in reimbursement, doesn't understand what they're getting in comparison with the market, and especially for new organizations. You were talking about kind of mental health. There's a lot of variability around those services, and I was talking to an organization in California that helps adolescent children from a mental health perspective, and they were trying to just build their first relationship with an insurance company, and they had no idea where to start, and reached out to us, and we were able to pull what Blue Shield California, Aetna, Cigna, and another a bunch of the other kind of leading payers or insurance carriers. We're reimbursing based on site of service, based on modifiers, the billing codes, the types of organizations that they were doing it with. And it was just able to give them a lot of confidence going in, and just kind of knowing where they could aim for and what was fair and what was right, just based on what's going on right now. And, got an email back saying like, hey, this was huge. This helped. We actually got what we asked for. And those things make me hopeful. So for me, it's about kind of the smaller organization from a healthcare delivery perspective, being able to get something that's kind of equitable for the services they're providing, so that hopefully they can provide good care, be sustainable, and pass that good care to the patient. So that's kind of been my lens. Jerry, you wanna?
Yeah. I'm looking at maybe more from a macro perspective. To me, the goal of price transparency is like the same as the goal of any company that, realizes, hey, we've got to we've got to be able to see what's going on before we can actually make any decisions on it, right? It's like data-driven decision making 101. Like, okay, well, what is happening? The kind of descriptive diagnostic piece of data and analytics. So, and healthcare as an industry is still so far behind. A lot of industries are well into, predictive and prescriptive data analytics and AI and all that stuff. And we're just still sitting here like, okay, what does this thing cost? What does this procedure cost?
Right.
Depending where you are. Like, that should be a question that could be answered instantly. And it's not even close to being instant, because one, there are some different permutations, but there's not that many.
Sure.
It's not like there's millions of different permutations per service. There really ought to be, well, what are the costs that go into it? How much does it cost to keep the people that you need on staff? How much does it cost to provide the actual materials? And what do you have to pay the performing physician to perform this procedure? And the way that we're seeing things, the way that the data comes through, one, there seems to be no rhyme or reason to what things cost and why. There's like relative ranges, but the best I can tell, it's mostly like, going back to your point, well, sometimes you just need to treat people. So you may have a higher volume of that, and you're hemorrhaging money on one part of your business. So you're making it up in other parts of your business. That's not the right approach from a pricing standpoint. So we have to first use the price transparency data to understand, like, let's normalize and minimize those ranges of what a knee surgery costs, a hip surgery costs, what are injectables cost to administer, kind of standardized things that shouldn't be so, different, especially when you have institutional charges that are plopped on top of the professional fees. A lot of that is there's just too much variation. So we need to like use the price transparency data to like, okay, let's get a baseline and normalize. And yeah, in New York, things are going to cost more. In California, things are going to cost more. In the middle of the country, maybe they should be relatively the same. You get into like Wisconsin and where there's more populous areas, so maybe it costs a little bit more there. Texas, some parts of Texas, right? Florida, you have an older population typically in Florida, so things may, there's more risk there. But that's how you should be able to look at a map, and that's what it should look like. It should look like, darker on the coast and in Florida, and maybe in the Northwest and north a little bit. But that's not what it looks like. It's all currently it's all over the place, and part of that is data quality and what people are publishing. Right, we know that some of the payers publish their regular fee schedules when really they don't have a regular fee schedule. They've got a multiplier on top of that regular fee schedule, so it looks like the reimbursement rates are lower or higher. Meanwhile, they're not. So, but we're still in that descriptive phase. What do these services cost? And let's get like a macro view of that and be able to say, at least for the most common procedures, there's not, again, tens of thousands of the most common procedures. There may be hundreds, maybe in the 1,000 range. But we should be able to get at least, what do these things cost? What should they cost? And let's stop, robbing Peter to pay Paul type of thing, where it's like, we gotta increase the price of this because we're losing money over here, or we're losing money on Medicare, so we need to jack up the price on private insurance. Like, we have to stop doing that.
Right. Right.
And that to me is the initial value, at least, of price transparency. Then we get, kind of further down the line of like, okay, what should things cost in specific situations? And you can start to personalize and tailor more to the individual, and eventually get to the point where it's like, all right, based on who you are and your risk, yeah, you're going to need kind of catastrophic coverage in case something terrible happens to you. But for the most part, you should not pay, $3,000 a month for a family of 4 to have health insurance, because you're just not using that. And similar situation, right? It's like, well, we have to charge you that because there's all these other people spending all this other money.
Right.
Okay. I get it. I think we should help other people, but again, we have to understand what we're paying into and why. It's not just like a giant pot of money. So I think over time we eventually get into this more tailored, patient level intelligence around pricing as well. So a bit rambly, but
yeah. No, I think that's a good summary of kind of big picture, and then stage one, what price transparency can do. Because you're right. First, it's about normalization. But we still have to, there's so many things we have to dig into. I've worked on a number of hospital projects where the hospital doesn't understand what things cost. They don't understand what the time costs, what the rooms cost, what the supplies cost. There's no management or control around the contracts for supplies, and how those supplies are moving from an inventory perspective. There's no controls on what the doctors can use or order from the EMR based on what, their preference versus where there is actually a contract and standardization. So lack of standardization, transparency, awareness from a cost perspective. Then you also have that from a contracts perspective, which is kind of what this price transparency thing is tackling. And then all of it flows down to the patient. So it's kind of this trifecta, or this 3-pillared problem that has to be attacked. There's probably more than 3 pillars, but there's maybe 3 is a good way to think about it. It's interesting too, in just kind of the just really quick as an anecdote, thinking about transparency to patients and the organizations understanding how much things cost. My wife and I were traveling through Peru, and we got really sick, which we don't understand to this day, because we were in Cusco, which has high elevation, and we were just had a little bit of elevation sickness. But we went into like a pizza spot, which I'm embarrassed to say. We're in Peru. We were tired. There was nothing else open. We go to this like little pizza spot, right? For Americans. And we go sit there, and we have a Coke out of the bottle. We eat this pizza. We hadn't had anything else and we end up with E. coli. We're so sick. We can't hike. We're trying to hike and do all these mountains, and we eventually made it to Machu Picchu. But like we were like, I thought we were dying. Like we were both in bed. We were just trying to, I like crawled out of bed. I can't remember. I was delirious. I got us a taxi to the closest hospital. We get to the hospital. We like pull ourselves out of the hospital. We're sweating, feverish. I was really worried about her because she's got other kind of pre-existing conditions. And we go to the bottom floor of the hospital, and the lights are flickering. You know, like in a horror movie or a zombie movie, you go to an abandoned building, the light. So like these really cheap lights are flickering, and like but it's all dark with just some flickering lights. And there's just like a one elevator. I'm just like, oh my God, we're gonna die here. So we get in the elevator, we go up, no choice. The taxi's gone. What else are we gonna do? And it gets a little bit warmer, and we see all of these thank you notes. Thank you, thank you, thank you from all of these different people from different countries. And I'm still like, oh, we're going to get ripped off. We're going to get taken advantage of. Something bad's going to happen. I was Googling and reading all these horror stories of going to like foreign hospitals. So I'm like delirious. And I tell them at the front desk, listen, I was like, I don't know what's going on, but we're really sick, but I need an itemized bill of everything that this visit could potentially cost us. And I need you to give it to me before we see you or do anything, or before you see us or you do anything to us. They were like, okay. I was like, huh, that's interesting. Still must be a trick. So they print it out, and it's got the room, the doctor's time, the nurse's time, potential medicine. They've seen this before. They're looking at us like, these people have E. coli. I didn't know what it was. Everything. And we get into a room, big, nice room, nurses. The doctor comes and spends as much time with us as a nurse would in the States. Like the doctor came and sat with us, spoke with us, made us feel better. IV, meds, full blood sample, full panel, labs, got the results back. Anyway, get this. I'm going to post this bill, de-identify it and post it. But we get this itemized list back of every single thing, including the meds. And it was actually cheaper than what they said it was going to be. And I think out of pocket, I paid like $400 US. So I remember that bothering me so much because I was like, that could just never happen. If I go down the street to Emory, which I did actually with my dad recently, and said, hey, can I have an itemized list of what you all are going to do? And he printed something out that just had visit and the amount, because I ended up paying cash for it, visit and the amount with I didn't have the billing codes or any of the details, just one line item. So it's like, that's the contrast. So that's kind of getting into the, a lot of these organizations kind of have no idea. They don't have the systems. Nobody's thinking this way. And there's just no transparency for the patient. Anyway, that's just like an anecdotal. It can't, I guess, for the purposes of what we're talking about, it definitely can be done. And to what Jerry was saying earlier, it's not that hard. This is not rocket science. I just saw robotic arms catch a rocket out of the sky.
Yeah, we're figuring out rocket science. That's not hard. This seems harder.
Yeah. So I guess after that, Andrew, you're talking to all these different people. You're talking to CFOs and entrepreneurs and people on all sides of this problem in healthcare. What are the insights you've gained after all of these conversations on all these conferences? Have you had any light bulb moments or?
Sure. Yeah. So in terms of some light bulb moments, I think one of them that comes to mind right out of the gate is this problem in addressing transparency, right? There's so much nobility in that. But I think that separate from that, there also needs to be a sense of, and you guys can absolutely speak to this from being the innovators and entrepreneurs in the field, is the ability to have some sort of an economic model to sustain the business behind it. So you can come in with the best of intentions and say, we want to do as well as we can. And of course, right, the goal is to continue to have that be the North Star. And then I think the challenge that I've learned from so many different folks I've talked to that want to innovate in this space or want to start up a price transparency company is, well, hey, it's really hard for us to figure out, right? Like, who's going to pay for this and how do we sustain ourselves and what does the business look like behind it, right? So I kind of wanted to go, I guess, in that direction just very briefly initially from an insight, because I kind of found that fascinating as we look at different people trying to enter the space. Of course, there's other things that just innovating in healthcare makes it very difficult, as it's got nuances that other industries don't, which we're very familiar with. Like, needing certain cybersecurity measures due to HIPAA, and just the amount of people that are in this industry, but also with the consolidation and how tough it could be to sell into some of these mass corporations. There's certainly a lot of challenges that healthcare has, which other industries may not.
Mm-hmm. Well, I mean, thinking about that, I mean, that makes sense. People trying to enter this space, thinking about the economics of it. What about the hospital leadership? What do they think about all of
Sure.
this?
So I think on the hospital side, there's been a couple of things that come to mind on their account. A lot of them, right? It was me kind of coming in and just internally, maybe I was making an assumption of, hey, like this should be able to be done, kind of like we talked about before. Like this isn't that difficult. But then talking to them and understanding their tech debt and the things that they need to continue to pull together to make this a reality. Also, another really important point that I was reminded of in my discussions is just how many things they have on their plate, and understanding where does transparency fall on their list of priorities, right? Because I think that there is so much that these hospital administrators and these hospitals are trying to tackle at this moment, whether it's staffing or dealing with implementing a new EMR or any number of other things. And so I think sometimes it can be tough for us because we're just seeing down this narrow lens of we live and breathe, whether it be transparency, price transparency, health economics, whatever this may be, whatever our reality looks like. And I think when we talk to people, it's really important to remind ourselves of what are some of the other things that are in their meetings, that are on their agenda, that they talk about with their colleagues, and where might the issue that matters most to me or piques my interest the most fall on their plate, right? Their plate of possibilities or their timeline of what they want to get to. So I think that was something that was definitely illuminating for me. And then another thing I'll say too is this just goes back to the price variation and other things that exist, is that there's in the contracting process, it's so complex and there's so many different ways that things could be paid for or arrangements. There's carve outs, there's understanding DRGs versus getting paid on CPT codes, and we talk about like RVUs, right? So just focusing on getting paid for a certain exchange of time, resources, supplies, whatever that may be. It's really, really tough to see things, right? Because healthcare has so many other nuances that sometimes it can be challenging when you've got these finance structures in place to wrap all of that together and to be able to do something with it that makes a lot of sense to a patient. And so that's something else as well that I also think the systems don't necessarily want to confuse. And it's also understanding, how do we present that itemized bill, or how do I present this information in a way that it can resonate with the patient? It wouldn't turn the patient off. It's not going to confuse the patient. It's not going to cause a flurry of calls back to our health system when we send that to basically say, hey, I don't understand. Like, why did it say this was 10,000, but then this got reduced down to 200? And now all of a sudden the patient is thinking, when they see those things, this is a sham. What's happening, right? Like, nobody wants that image, right? Nobody wants to have that perception from the public. And so I think that there's a lot of ground to be had on, and a lot of movement that needs to be made on, to your point, sending the itemized bill and giving people that understanding, hopefully even without them needing to ask for it, just like we were walking into a restaurant, being able to get that itemized bill, but doing so in a way that empowers them, helps them to understand what's going on, doesn't cause confusion. I think those things are really important to be mindful of. And that's absolutely some things that probably flow through their mind when they think about, or for some have even tried to do itemized billing and then end up rolling it back due to seeing some of the impact that it's made on their patient populations.
Interesting. Do you know of any situations where organizations have rolled back itemized billing?
So in some discussions, it's been mentioned. It hasn't been like a massive theme, but it did just come to mind as something that was a light bulb moment or a learning for me, because I think sometimes we come into the space and we say, hey, shouldn't everybody be doing, or why isn't everybody doing itemized billing, or have you tried this before? And so it was a really rare occurrence for me to hear that it was tried, and then there's reasons that because it caused so much confusion, or because it caused so many more calls back into the hospital, which we know staffing could be tough and they don't want phone lines clogged up. Yeah. It makes sense, right? I think that we also have to be exploring these issues on using our emotional and our rational logical mind, right? I mean, they teach that in mental health and in therapy, right? Your wise mind is the rational and emotional. And sometimes, right, just the emotional side of us can say, we need the itemized bill. Like, this doesn't make sense. It has to happen. But then also, I'm really trying as well in these discussions to level with others and really put myself into their perspectives on, well, what would the logical side be, or what might that look like? And so I think also when we explore that, it's not just, there's this sense of, I can understand and see the logic behind what you're saying. And that doesn't necessarily mean that I have to agree with everything that that represents. I think that's a really important delineation to make, is understanding why things occur the way they are purely out of logic and rationalization, without necessarily trying to attach ourselves so much emotionally so that it prevents us from being able to really deploy that person's perspective in a very thoughtful way.
That's really interesting. That makes sense. Yeah, I mean, at the end of the day, itemized billing with our existing system is only exposing the problem to the person that it affects and hurts the most, the patient, but it's not fixing any of the inner workings. And so, while I think it's important to have it, it's going to create that sunlight. It's going to create it's going to be a disinfectant. It's going to create pressure and exposure to then change some of the fundamental move some of these fundamental boulders. But that being said, that's going to take time, effort, concerted effort. So I think it's a really interesting perspective. I never heard of that or thought about that perspective of like, okay, now our phone lines are plugged up because we've exposed this thing that's not good. Everybody knows it's not good, but here we are. That's interesting.
And I think too, to something that Jerry had mentioned earlier on the reimbursement rates and the variability, and really struggling to find a justification in that mass variability. I mean, we kind of go back to leverage and lever pulling and the contracting process, and just understanding maybe we do more colonoscopies than we do deliveries of newborns. And, we're kind of looking at reimbursement at this level because the volume is higher here versus there. And so I think you have some of these other things that may come into play in those contracting processes that sort of to the public and to others, it may not, it may not make sense. It may not kind of register. It's hard to understand why we're being billed the way that we are. But there are some things that happen behind the scenes that reflect those things. But then also when we talk about price and predictability, these contracts, I mean, and correct me if I'm wrong, but in the contracting process, it's not like the rates are being reset every month. Some of these things are evergreen. Some of them continue for a little while. Sometimes they reconvene on some things every couple of years. Maybe it's annually. I've seen different arrangements or different timelines on these things. But I think that when you hear that from a public-facing perspective, then you're wondering, hey, if there's some sense of what's known in this process, then wouldn't there be some sense of what's known when I come to your system or when I interact with the system, of what that sort of rate would look like if I'm able to disclose everything that I can from an insurance and a plan type perspective to you?
Yeah.
I think that's no, I think that's you hit on an important point there, which is just consider the scale of the negotiation problem, right? You think of one hospital that that's near you. And think about how many billing codes or how many services that they provide. It's thousands. And there are different scenarios, and there's different people performing those services, and they pay those people differently depending on who they are. And, maybe a physician, but a physician who's 27 years old is very different than a physician who's 65 years old. And you're going to have to pay that physician that's 65 years old probably a lot more because he's a lot more experienced or she's a lot more experienced. And you want to make sure that you have the best people, right? So now you're already starting at a kind of a mishmash of, well, we have to charge a little bit more because our average cost is a little bit higher. And again, you'll see that on the coast and in different parts. But think about the scale problem of just one hospital and having to negotiate thousands of services. One with no, it's not like there's a list, you can go on Amazon and see like, all right, well, on average, a new set of speakers is between $50 for like not so great quality, $100 for like a pretty decent one, and the Amazon recommended one is $122. There's no list like that. And I mean, now we kind of have a list, but it's extremely massive and it's not actually reflective of reality. But we'll get there. But just that scale problem, that's just one hospital. And now you have these insurance carriers that have to negotiate with not just 6,000, 8,000 hospitals a year, but it's every physician group and imaging center and infusion center and all of these other things. There's only so many people. There's only so much time in a day that you can spend doing that. And so I think a lot of us also tend to kind of think of things in a very small kind of microcosm of what's happening, right? And you'd be like, well, why does it work like this? This doesn't make sense in my situation. It's like, yeah, well, honestly, you're the only one who ever thought about it in that situation because you're the only one this has ever happened to. So yeah, the solution is obvious, but try and scale that up. How do we do that? And again, this is the first step. It's like, can we get to that standardized price list that's not specific to a carrier? It has their standard price list, right? And then they negotiate off of that. United has theirs and Cigna has theirs. But if we could have one, and supposedly that's Medicare. Okay, we use Medicare as the single list, but that's not based in any reality either. But this is where we have to kind of get to this point that just the scale of this problem is so huge that even having even negotiating just a few rates on an annual basis would be hugely burdensome and increases the cost to the hospitals. I mean, you don't want to have, hospital administration costs have gone through the roof in the United States, partially because of regulations and mandates and all these different things that they have to do. But also because they have to continuously conduct these investigations into, hey, how can we make sure we're making more money? And then there's just kind of a race against the clock investment of like, all right, well, we hired 50 people. Like we have to recover enough money to pay for those 50 people, but then we actually have to turn a profit on top of that because we're losing money over here. And I think we just end up with lots of people who have lots of jobs with not a lot of clear direction of what they're supposed to be doing and how much and what the actual potential for saving money is. So complex problem, but we're at least starting it now.
Yeah.
2024, bit late, but at least we're starting. You got to start somewhere. So
yeah. One of the things I really don't like about that and thinking about the overhead and the churn of renegotiating an entire contract is the news feeds I continually see of a health system and an insurance company falling out of basically doing falling out of contract and basically doing a PR news feed of, hey, these people are being difficult. And it's kind of a race to like who does it first, who pays for it, and who has the best marketing team. Because I saw one recently where one of the big insurance carriers did a really pull on your heartstrings video of these sick kids with cancer because they were battling it out with the children's hospital. But their insurance carrier's video was of those kids at that hospital and that hospital's nurses and doctors taking care of these kids. And the message was like, hey, this hospital is being really difficult. They don't care about these kids. We care about these kids. And I'm just like, what? I'm like, this is horrible. First of all, this is a really bad taste. Whoever did this is completely toned it. I don't think anybody's going to see the insurance company as the good guy in this situation. And then they're kind of plastering kids on their YouTube video. But at the end of the day, both of these organizations are playing chicken, if that's still a relevant term. That is, for the listeners, when two cars drive towards each other. That's how we used to entertain ourselves in this country back in the day before computers. You just get in your car and you would just drive full speed towards your friend, and one of them would get scared and turn away. Or apparently that's what the old movies show. I guess that's what we were doing. Everybody was just doing that back then. I joke, but
So
they're
driving
basically
so high.
that's right.
Driving
They're,
into each other, jeez.
yeah, exactly. But they're basically doing that with our health. They're playing chicken with our health. They're doing a negotiation. They're going to say who blinks first. Maybe a more relevant game, but who blinks first. But the patient in this case, children with some of them with cancer are the ones left with the short end of the stick. And sometimes a bunch of people that had coverage or fall out of coverage, and they have to get an email from the health system saying, "Hey, you're no longer in coverage. I'm sorry. You're gonna have to figure it out." And it's just really bad. It's really bad taste, and it's going to increase because now these prices are out here. Companies like ours are trying to make this. Trying to democratize this information, make sure people understand it's there, which still people at hospitals don't even realize this data is there. It's accessible. You can use it for negotiation. You can use it to understand what the market cost of something is. And it's caused a lot of people to want to go back to the drawing board. So I think we're going to actually see more and more of these kind of public battles between the insurance carrier and the health system over time, which I think is going to be more and more kind of anxiety and people that need healthcare losing out until we get to this normalization. So I don't know. I hope in the end it's better for everybody, but I hope there's reduced suffering for along the way, because I think this is going to continue to get worse.
Yeah, that's a question I actually would love to share and ask you guys, Jacob and Jerry, both. I mean, as folks that are in the weeds and leading the charge right on this this innovation and entrepreneurship journey for transparency, would love to get your take on the impact of this transparency data to date on the industry, on the public. I think, Jacob, you alluded to two things, right? That are basically said two things just now of the impact, which is that there's going to be more public battles potentially. And then you're also seeing the trend of people who, whether they're seeing the data or they're just unhappy with their reimbursement, they're saying, you know what, I'm going to go out of network now. And there's this mass thing, especially in mental health. I see that a lot with therapists and private practices, that if they're in wealthy enough communities and they know that the community or there's folks that can bear it, right? And I don't think it really makes sense for us to sit and debate right and wrong per se, as much as we just identify the trends that we're seeing. So would love to ask you guys, what are some of those other impacts outside of people dropping coverage or not being willing to take them? And then also these public battles, anything else that you feel like is noteworthy that you've seen on the impact side?
Well, I think one of the big ones, and then I'll pass it to you, Jerry, is kind of the last one you said, Andrew, the going out of network, which I think the going out of network is also, this has been the catalyst for people to strongly consider completely different business models that are completely outside of the insurance carrier and the health system. And I have a young family member who's out of med school and practicing, and that's going to be his path. He's going to do a subscription, as a service, primary care, and I mean that's what he's going to try to build for himself. So there's a lot more kind of independent thinking outside of the system. I think the system has gotten so bad that people have realized that you can't get much worse than what already exists. And so I think there's going to be a lot of people trying to do either cutting the insurance company out, cutting the health system out. There's going to be direct to employer models. And so I think we're going to see a lot of that. And I think somebody's going to figure it out. There's going to be a lot of failures, but somebody's going to figure it out. And with technology, with AI, with all of this data, and potentially with other data through more furthering the transparency acts, I think we could get to a point where there could be a kind of fundamental shift in how people receive and pay for care.
Jerry?
Yeah, I mean, I would agree with. I mean, obviously agree with all that. I think there's other implications as well. There's a lot of, we talked to a lot of different people across the healthcare industry every week. And I think some of the things that were very surprising to me were that unless you came from another health system, or even if you did come from another health system, they still were surprised to see how things work at other systems. And I think that has been somewhat of an awakening for people to see, like, okay, either it's similar. Oh, they do it the same way. We thought we were very unique in the way that we did contracting. Or why are their rates so much higher than ours? Like, what are they doing? Like, and maybe they're missing some context, right? They're looking, you still have to do volume comparisons and things like that. But in a lot of cases, it's like, yeah, they just have a good negotiating team and they negotiated very good rates for these services. They convinced whoever that. Now, maybe like I said, there could be other reasons for that besides just good negotiating power. But I think this does represent kind of, like I said, the first step in that fundamental shift of like, here's how healthcare is going to get contracted in the future. Also, a very big thing that we haven't really talked about is the employer piece. And I think going direct to employer, being able to see these numbers for the first time, having them published out there, you kind of get into that similar situation that we were talking about before, where behavioral health centers, they were typically working with, directly with people, or charging out of pocket, and then they want to go and work with an insurance carrier, and then they're like, well, how, we have no idea how much we're supposed to ask for. Like, presumably it's less than we're charging cash, but maybe not. Maybe it's more because they have a bit more of an incentive to keep the community healthier. They honestly had no idea. It's the same thing for employers. Employers, you're going in and saying like, well, I don't know, why does a knee surgery cost $25,000? Like it takes 4 hours. Like, where's that money going? It's a lot of them are outpatient now. Who's for what? Where's that money going? We're doing 200 of them a year. Should we really be paying millions of dollars for knee surgeries? Like, is there no better way to do that? Meanwhile, now they can go to their competitor's plan and be like, oh, somebody who negotiated this rate actually knew, maybe came from a health system or came from an insurance carrier and in their HR team and said, no, it's going to be, $8,000. And that's a fair price for your knee surgery. And, I think you're going to start to see like, well, wait, all right, now they're contracted with the insurance carrier, but what if we were to just go to the hospital and the hospital says, we're only getting like, $2,500. So just go direct with us and pay us $3,000, and then you don't have to deal with an insurance carrier, and we'll send all your people to us, and everybody wins. It's lower cost for the employer. Everybody besides the insurance carrier, I guess, wins. But the purpose of the insurance carrier is to make sure that everybody's actually getting paid for the services that they're providing. If you can do that direct to employer, then there's no need for that service. So I think that's going to be a huge use case. And we're working with some companies that do employee benefits and work with employee brokers and things like that. And we're starting to build out those use cases. The data is extremely large, as you guys know, but those nuggets of gold are in there. And I think we're going to start to see a lot more direct to employer plans, possibly like SaaS, B2B SaaS companies that are leveraging this data to help create plans between local providers and local employers. Because the savings there, it's not, hey, we can save, $2 million a year. It's going to be, we can save $200 million a year by doing something like this. And that money is just going directly into the pockets of the insurance companies right now. So again, they're providing a service. It's not like it's free. They have people that have to deal with all this stuff. But, if we can cut out the cost of $200 million and put that back into the pockets of employees, lower their premium costs or potentially even cover the costs of everything, that's going to be a huge incentive for our employers to do that.
It's an incredible point. And I think that the employers absolutely, I'm glad they've entered the discussion from that, because when we think about healthcare and who the true payers, who's funding this system that we sit in, right? It's the private households that are income producing, the employers that are sharing in that premium spend and those arrangements, right? So when you look at the patients and the individuals in this country and the folks who are working jobs and whatnot, and then you also look at the employers who are providing those jobs and creating those benefit plans for those people and their families and their dependents and beyond, right? Those are the groups, right? Those are the stakeholder groups that we need to continue to push alignment toward. And then the other point I wanted to make was, so you have transparency, but then with transparency also unlocks accountability. Because if I can see all of these different things or these numbers, or I can start to benchmark and have these other aspects come into play, I can also hold you accountable for them. And so I think that when you've got an industry that it hasn't had a lot of this sunlight, it hasn't had a lot of this transparency, and all of a sudden you're bringing that in with these machine readable files, with this other data, with some other important aspects into mind, all of a sudden people are waking up a little bit. And they're also saying, like, yeah, they can see things too, right? Information is everything. Knowledge is power. Think about how different the discussion becomes. And you guys have seen it in the negotiations when you have that insight into the financial information, whether that's an employer that's approaching a hospital system, whether that's a hospital system that's approaching an insurance company or beyond. When you have that information, that allows you to use that L word that we talked about earlier, leverage, right? And allows you to have a little bit more of an ability to advocate for yourself, which comes back to the original point that I made about social work and why I got into healthcare and my passion for sticking up for those who are at a disadvantage or people that may be considered to be the underdog in whatever storyline you may immerse yourself in.
Yep, absolutely. I mean, Andrew, I remember you've said in the past, healthcare does not operate based on free market principles. And so I hear a lot of that in what you're saying now. Could you elaborate on that? Like, what do you mean by that?
Sure. So there's a lot of different entities that sit in the supply chain, right? And so when you've got these folks, like, for example, insurance companies and beyond, they're sort of masking the true cost of care, right? What I'm doing is I'm now another person that has entered the transaction. So instead of, right, Jerry, you're walking in, I'm serving you a cup of coffee. I say, hey, it's $5. This is what's on the menu. Well, instead of you maybe walking in, every time you walk in, maybe Jacob's with you this time. And Jacob's like, well, hey, I know Andrew. And Andrew always gives me a cup of coffee for $3, right? But then the next time you walk into the coffee shop, I don't know, it's another one of your friends or colleagues. And they're like, well, I know Andrew, but I haven't worked with him, or I haven't come to this coffee shop that many years. So he gives it to me for $4. And so what happens when you have these different arrangements that's based on your relationships and your parties is that there's not as much of that free market competitive nature at play. And so I think when you have this level of control that's happening by a few very, very powerful parties in the space across these different buckets of stakeholders, what really ends up missing from that is choice, right? Being able to make that informed decision. And so when choice is missing from the market, that essentially allows the flow of money, resources, and people to be controlled at a greater extent. And I think, too, that's really what a lot of us are dialing into when it comes to the transparency, when it comes to the accountability, and when it comes to delivering excellent value to the patients, to the employers, to the people that are actually handling the procurement of these different services, right? And are interfacing with this system on a regular basis, is we want to have a little bit of that flexibility.
I have nothing to add to that. I think that's
perfectly said.
Perfect. All right, let's cheer things up a bit. Let's talk about the future. So again, you are the master of connecting the dots, connecting thought leaders together, and you do a lot of that through conferences. One that I missed that we really wanted to see you at was Health Rosetta. Tell us a little bit about Health Rosetta. I think that's David Chase, right?
Yes. Yeah. So Health Rosetta has been one organization on my radar for a little while now. I read his book, before actually interfacing and kind of getting a sense of what the community was all about. Essentially, right, what they're really driving toward is this new healthcare economy that does value the true payers of care, the employers, the patients. It's focused in on this transparency, but as we talked about before, the accountability, having some alignment with the financial incentives that happen, right, and then being able to directly work with those employers and usher in these sort of new age advisors that are essentially saying, hey, you can see where all of my compensation comes from. You can see what my arrangements look like. I'm here to deploy my knowledge and my skill sets to you. And I'm talking about the employer, right? These are the advisors that are going to the self-insured groups, or the groups that are debating self-insurance, who are currently in fully insured models, and saying, this is what I can do. This is how I'm different from some of those other groups. Now, the hard part about this, right, is that we have this sort of the rate of innovation pushing past the status quo. We've got the psychological fear of change that's embedded in all of us as humans. So it's certainly an uphill battle. You can see the strength behind the movement. You can understand the pillars that sit around it and are allowing it to really build up. It's quite exciting. It's been growing. His community has been growing a lot over the last couple of years. It was my first time going to this conference, but I was very encouraged by the energy that I was seeing there, the solutions that were there, the people that I was meeting, the passion that they have for this new way of thinking about healthcare and making sure that it gets delivered in a very valuable way to the folks who are genuinely funding it.
That's awesome. We'll definitely be there next time. Yeah, because I mean, it's been interesting seeing a mix of, it's mostly been encouraging, but you definitely get the breakout sessions that are like, oh, it's really hard, and maybe we'll wait and see what happens. So, but we don't need that to make change. We need change agents, we need vanguards, we need people to push. And I feel like being at HFMA, seeing you at the Price Transparency Conference, hearing your take on the Health Rosetta conference, I feel like the momentum is there, to your point. So I'm really excited about that. Well, I mean, what's next for you, Andrew? Like we're I can't believe the year's almost over. It's been a whirlwind. What are you thinking about next for you, and within the context of price transparency, and just for you personally?
Sure. Yeah. So the next steps really is going to be, how do I deploy some of this knowledge, right, that I'm sharing in the podcast, that I'm sharing with other folks through the research I've been doing? How do I deploy it into industry? What makes sense? Pretty much working with, as we had talked about, the employers to help them understand what this information means, what engagements or companies they should start to become aware of, and really begin to immerse myself in that day to day. I mean, I think it's really, really important to understand the role that they play and the importance of serving that stakeholder group. So that's really what I see. And I still continue to this day to be amazed at everyone that I speak to acknowledges the problem of a lack of price transparency. But there's been a lot of action and sort of direction. The rubber just hasn't been meeting the road to the scale and the depth that we want it to be. I mean, I'm incredibly optimistic with the policies and all of these other people that are really focused on driving it through, whether it be through business or through industry or doing some things in government and beyond. It is really, really fascinating, but there still absolutely is this disconnect. And so I continue to be curious on, why does this remain, right? I have this obsession with the problem of, why does this continue to remain, when a lot of us, I mean, most of us, when I talk to people, it's clear on what the issue is. And I think we unpacked a lot of that when we talked today on some of those under the hood issues and a lot of the challenges that it seems like it would be an easy change, but then understanding the fundamentals behind that change and really taking a moment to say to ourselves, what is this entire problem and where does it stem from, right? Because we all work in a specific role. We might be siloed or partial to that role and what we need to deliver on, but we also need to take a step back and realize, hey, how are things being done? What is the motivations and the why behind this? How does the money flow? How much self-interest is baked into that flow throughout the supply chain, and really diving into that. So it does take a bit of time.
Well said. Well said. Well, I know Andrew, you have your background in social work. You always want to give back. You care deeply about people. And so I know when you join podcasts, you always like to leave some personal development guidance, which I love. So I'm giving you the floor now. I don't know if you have anything prepared, but I know this is something you like to do and give back. Any personal development or self-help tips for any listeners out there?
Sure. Yeah. So actually, I'll give you one that came through my feed on LinkedIn yesterday that I thought was very excellent. I can't take credit for it, but essentially creating a way to have psychological safety among yourself, your colleagues, your clients, the environments that you're in is super important. So this whole notion that, hey, feel free to disagree with me. Feel free to challenge me on something. Essentially, the post was baked a lot around you've got founders, you've got leaders, and based on their influence, the positions that they sit in, they may end up hearing yes quite a bit, right? Because it's just all of the success is a bit overwhelming when some interact. It's like, I couldn't possibly challenge them, or I couldn't possibly counteract what they may be saying. And so I think it's really important when we talk about personal development and growth to allow ourselves to be able to welcome that and encourage that other perspective. And it really loops super nicely back to a lot of what we've talked about, which is encapsulating so many perspectives in healthcare to really dial in and unpack this issue of a lack of price transparency.
Awesome. Well, I'm really glad you're a leader in this space. I appreciate your curiosity, your humility, and the fact that you've brought so many different perspectives together. So thank you so much for your time. I'm glad to call you a colleague, glad to call you a friend. Jerry and I were blessed the day we were able to meet you and see you kind of for many sessions after that, many days after that, navigating these crazy and wild conferences. So looking forward to continuing to put a voice out there for good and for current state, but also encouraging of where we are going and what we're going to be able to accomplish together. So thank you.
Appreciate you guys for having me on. Always a pleasure to chat. Looking forward to more discussions, and definitely we'll be seeing you guys at conferences in the future.
We'll see you there.
Sounds good.
All right. Nice job.